AHEADinVET, which stands for Vocational Education and Training, is an Erasmus Plus project co-funded by the European Union that aims to upskill VET teachers and trainers in dealing with the mental health of their learners. You're listening to the AHEAD in Mental Health, Navigating Mental Health in Vocational Education podcast. AHEAD in Mental Health, Navigating Mental Health in Vocational Education is a podcast series that delves into issues related to the mental health of trainees and trainers in the VET sector. Experts in the field of mental health and VET will be sharing their experience and expertise, allowing us to gain a better understanding of the mental health topic. I am Lydia Vakula, project manager of the project, representing Excelia and the consortium. Thank you for joining us and enjoy. Today's episode features Martina Tulli, a psychologist and a support teacher, and she's going to help us discuss understanding VET students' mental health needs and impact of VET environment. Thank you very much, Martina, for being with us today to discuss this topic.
You're welcome.
So, as I always say in the episodes, in every recording, will you allow me to lead the discussion with some questions I have gathered on the topic? Thank you. So, introducing the discussion for the first segment of this interview, I would like to ask you what inspired you to focus on mental health in the VET education sector?
So, what inspired me to focus on mental health in the field of VET schools comes from the recognition of how critical this space is for young adults, making the transition to the world of work. VET institutions play a key role in shaping the skills, confidence, and readiness of students for the careers they have chosen. However, the fact that demands, uncertainties, and challenges within the VET environment have an impact on students' mental health is often overlooked. Many VET students face stressful situations, such as balancing school requirements with work or family responsibilities, financial pressures, or anxiety about obtaining a future job. This can increase states like anxiety, depression, or burnout. There is also a growing recognition that mental health is central to student success. Environments should be promoted in which students not only acquire technical skills but also thrive emotionally and psychologically.
Yes, I think you're very right. And why do you think is mental health such an important issue for VET students in particular?
Mhm. So, the VT students often come from a wide range of backgrounds, including marginalized or disadvantaged groups. The students may carry additional mental health challenges related to their life experiences, such as anxiety, trauma, or socioeconomic stress. Many VT students have more responsibilities than their education, such as working part-time or full-time, caring for family members, or managing financial stress. The pressure to balance these demands can lead to high levels of stress, anxiety, and burnout. Moreover, the VET sector is designed to provide students with specific skills for immediate entry into the world of work. However, uncertainty about job prospects, especially in rapidly changing sectors, can generate considerable anxiety about the future. In VET, students may feel further burdened with the stigma surrounding mental health, especially in areas where strength is valued, such as trade, construction, or other physical and practical skills-based professions. The stigma can prevent students from seeking help, aggravating problems such as stress or anxiety to a point of crisis. Untreated or unsupported mental health problems have a direct impact on school success. When students struggle with their mental well-being, they are more likely to disengage from studies, drop out, or not complete training.
You're listening to the Hidden Mental Health, Navigating Mental Health in Vocational Education podcast. I understand. So, moving on to another segment of our discussion, so we can understand mental health needs of VET students. How would you say the VET education environment can impact mental health?
The VET education environment can significantly influence students' mental health, both positively and negatively. The nature of VET is distinct from other educational pathways, as it focuses on practical, hands-on learning in specific fields, often designed to lead directly to employment. This focus on job readiness can create stress and anxiety for the students. Unlike purely academic settings, VET students are assessed both on their theoretical knowledge and practical skills. Many VET students come from lower income backgrounds and may already be working to support themselves or their families while studying. The financial strain, along with the urgency to find employment after completing the course, can increase stress, making it harder to manage mental health effectively.
Mm-hmm. I see. Could you say something about the unique mental health challenges faced by VET students, perhaps, Martina?
Mhm. So VT students face a range of unique mental health challenges influenced by their circumstances. Some of these specific challenges include balancing work, study, and private life, because many VT students have to manage multiple responsibilities such as jobs, family care, or housekeeping in addition to studies. This can make it difficult for them to prioritize their own mental well-being. High levels of anxiety and uncertainty. For many VT students, the pressure to move quickly from education to employment creates anxiety about the future. Specific industry pressures. Some sectors related to VT education could be linked to a culture that discourages open discussions on mental health. Students may feel pressure to fear being judged if they seek help.
That's a very important issue. What would you say, what is the impact that the VET education environment has on students' mental health?
So the VT education environment can have both positive and negative effects on students' mental health. Between the positive impacts, we could say that many VT students feel a strong sense of purpose as they acquire practical skills that are directly tied to the future's careers. This clear path toward employment can boost self-esteem and provide motivation. In vet schools, also, students work closely together, supporting each other. This can help build a sense of belonging and reduce feelings of isolation. For VET students, the focused nature of VET can be more engaging and rewarding. Succeeding in this type of environment can build confidence and improve mental well-being. But there is also a negative impact. In some VET environments, particularly smaller institutions, there may be fewer mental health resources available. Without access to counseling or support, students may struggle to cope with their mental health challenges. Moreover, the transition from the VET environment to the workforce can be stressful, particularly if students feel unprepared for real-world pressures or if their expectations of job opportunities do not match the realities of the job market.
Mm-hmm. I see. As an expert, how would you say that VET schools and teachers could identify when a student may be struggling with their mental health?
There are some things important to notice. For example, behavioral changes such as frequent absence, tardiness, disengagement in class, or a sudden drop in academic performance. They might appear distracted, fatigued, or uncharacteristically withdrawn. physical and emotional symptoms. Students may show visible signs of distress, such as appearing anxious, tearful, or agitated. Some may also experience physical symptoms like frequent headaches, stomach issues, or complaints of fatigue, which are often linked to underlying stress or anxiety. Increased isolation. If a previously social or engaged student suddenly becomes more isolated, avoids interactions with peers, or withdrawn from group activities, this could be a red flag that they are experiencing mental health issues. Expressing overwhelm or hopelessness. Teachers should listen carefully to students' comments. If students frequently express feeling of being overwhelmed, talk about hopelessness, or make statements that suggest they are struggling with self-esteem, this could indicate mental health difficulties. And peer and self-reporting. Sometimes students may confide in their peers about their struggles, or another students may notice changes in their behavior. Peer support can be an important source of information for teachers. Additionally, some students may openly discuss their difficulties with a teacher they trust, so maintaining an open, approachable attitude is vital.
You're listening to the Head in Mental Health, Navigating Mental Health in Vocational Education podcast. I think this is very, very interesting, Martina. Moving on to the final part of our discussion, as it comes to approaches for supporting PET students with mental health needs, what do you think are some effective strategies for supporting PET students with mental health needs?
So, BET schools should provide training for teachers and staff for recognizing mental health issues, understanding the signs of distress, and responding appropriately. Encouraging a culture where students feel comfortable approaching teachers with their concern is critical. Teachers can facilitate this by regularly checking in with students on both academic and personal well-being. But also, BET schools can provide mental health support by promoting access to counselors, mental health workshops, and stress management programs. Even partnership with external mental health professionals can ensure students have access to necessary resources. If a teacher suspects a student is struggling, it is important to reach out early. A compassionate conversation, along with the direction of the students to available support services, can prevent further deterioration of their mental health.
At this point, could you say a few words and could we discuss about the importance of early intervention and prevention when it comes to mental health?
Addressing mental health issues early can prevent more severe and long-lasting problems from developing, which is essential for students' well-being and academic success. Mental health issues like stress, anxiety, and depression can escalate if left unaddressed. Early interventions allow schools to provide support before these issues become debilitating. When mental health is supported from the beginning, students are more likely to perform better. They can focus, engage, and complete their work more effectively. Preventative strategies such as stress management workshops and resilience training equip students with tools they can use throughout their careers. This not only benefits them during the studies, but also helps them manage a future stressor in their professional and personal lives. When schools take a proactive approach on mental health, it helps normalize discussions around mental health issues. This can reduce stigma, encouraging more students to seek help early instead of waiting until they reach a breaking point.
Mhm, mhm. Could we say a few words as to the responsibilities and boundaries of teachers in dealing with mental health, because I think this is a very important part as well. How much responsibility should one take, and who sets the boundaries in this case?
Teachers in the VET environment have a critical role in supporting students' mental health, but it's equally important to define clear boundaries regarding their responsibilities. While teachers can be a first line of defense in identifying students who may be struggling, they are not mental health professionals and should not be expected to provide clinical support. They can offer emotional support and a listening ear when students approach them with concerns. Teachers are often in a position to notice behavioral changes, academic struggles, or signs of distress. It is their responsibility to identify warning signs. Teachers should be willing to make reasonable adjustments for students struggling with mental health issues, such as offering flexible deadlines or alternative assignment when appropriate. But while teachers can offer basic support, it's critical to refer students to mental health professionals for any concerns that require clinical intervention. Teachers should not attempt to provide therapy or counseling unless they are specifically trained to do so. Teachers should avoid becoming overly involved in a student's personal life. This can lead to emotional strain on the teacher and create an unhealthy dynamic. The boundaries are typically set by the school or institution, guided by policies related to students' welfare and teacher roles. Schools should provide clear guidelines and training for teachers on how to handle mental health issues. It is also important that schools provide teachers with their own support system to prevent burnout from taking on too much responsibility in this area.
That's exactly it, I believe. So, having said that, how can VT schools, do you think, and teachers promote a culture of mental health and well-being among students?
So schools can integrate mental health awareness into the curriculum by discussing it openly in classes and providing resources that highlight the importance of mental well-being. Providing training to teachers and staff on how to recognize and respond to mental health issues is critical. This could include mental health first aid training, where teachers learn basic techniques to support students and refer them to professional help. VET schools should ensure that there are clear, accessible support systems for students to access mental health services. This includes having counselor on site and providing information on external mental health resources. Teachers and staff should actively encourage students to talk about their mental health. By making it clear that mental health is an important topic and that seeking help is normal, schools can create a more open and supportive atmosphere. Schools can support students' mental health groups or peer mentorship programs where students can share experiences, offer support, and foster a sense of community. By creating an environment that prioritizes mental health through awareness, resources, and open communication, VET schools and teachers can foster a culture where students feel supported, both in their studies and their personal lives.
Martina, thank you very much for this analysis. It was extremely interesting. Since I have no more questions on the matter and closing this discussion, I would like to try and summarize the main points of it. And maybe if you could provide some resources for listeners who may be looking for further information or support.
Mhm. So, in our discussion today, we explored the important topic of mental health in the vocational education and training (VET) sector. focusing on the unique challenges that VET students face and the role educators and institutions can play in supporting their mental well-being. VET students often experience high level of stress due to the practical and intensive nature of the training. Balancing academic and hands-on learning while also managing personal and financial pressures can lead to anxiety and burnout. The fast-paced transition into the workforce adds additional pressure, causing students to experience self-doubt. Early intervention is key to preventing mental health issues from escalating. By recognizing warning signs and offering support early on, schools can help students manage stress and anxiety before it becomes overwhelming. Prevention efforts such as mental health awareness and resilience training empower students with the tools to cope with challenges, both during their study and their future careers. Teachers in VET settings have a unique opportunities to support students by identifying those who may be struggling with their mental health. However, clear boundaries are important, as we said. By creating an environment that prioritizes mental health, institutions can help students succeed both academically and personally, preparing them for a healthy transition into the workforce. For listeners seeking further mental health information and support within Europe, here are some valuable resources. The European Mental Health Compass, an initiative by the European Commission that provides information and guidance on promoting mental health and well-being across European member states. It also connects people to mental health programs and services in different countries.
Martina, thank you very, very much for being with us today to discuss this topic. This was a very interesting discussion. Martina Tulli is a psychologist and a support teacher. She helped us elaborate on understanding VET students' mental health needs and the impact of VET environment. Thank you for listening to the AHEAD in Mental Health, Navigating Mental Health in Vocational Education podcast, a series produced as part of the Erasmus Plus project AHEADinVET. Remember, mental health is an issue for which conversations need to continue, evolve and flourish, and together we can create a more compassionate and supportive VET community. For more information about the project, feel free to check out our project channels and follow us on Facebook, Instagram, Twitter and LinkedIn. Find out more on our website www.AHEADinVET.com.